No worries. Okay. All right, our population of focus next is our individuals transitioning from incarceration. So like I said earlier, that's going to go live in January of 2024, and that's going to be for the adults and the children of youth. And that's going to be eligible to all members who are transitioning or who have transitioned from an incarcerated setting in the last 12 months. Kind of like the experiencing homelessness population of focus, the adults do have to have some extra criteria to be eligible for this population of focus. The children and youth do not. They just have to be transitioning out of incarceration. Right. Another one of our children and youth populations of focus is going to be our children and youth enrolled in CCS or whole child model. And this is going to be the kids who are enrolled in this, but they need that extra layer of case management. So it's going to be your most complex kiddos who are enrolled in CCS, and they just need that little bit of extra help. It's not duplicative for the state, so we're going to enroll them in ECM. Sorry, nope, I lied. They can be in ECM, not in CCS at the same time. So it's going to be, the kiddos who need that extra layer of care, they're going to be in ECM, and then the ones who are pretty well managed are going to stay enrolled in CCS. I apologize. All right, ECM population of focus number 8 is going to be our children and youth involved in child welfare. This one we're still trying to operationalize internally. How to quickly identify these members to refer out. But they're going to be the kiddos who are under age 21, but also can be up to age 26 who are in the foster care system. Those are going to be eligible for this population of focus. Okay, and then this is a little bit different than what was previously provided by DHCS. So the birth equity is going to be live in 2024. There used to be a pregnant and postpartum population of focus that was separate from birth equity, but per the new policy guide that was released in July, those are kind of being put together as one population of focus. So the population of focus criteria for this one is going to be the adults and the youth who are pregnant or postpartum up to 12 months. And then they also meet a qualifying factor for birth equity. So they are eligible in any other population of focus, or they've got the racial and ethnic disparities. Okay, so those were the spotlights on the population of focus themselves. Here's a few numbers just for reference in Marin County. We have 10 providers who are live right now. We have 790 ECM members in Marin, either referred or enrolled or currently in outreach. And that includes 254 of the children and youth, and then the rest are adults. And then I'm sorry if this is kind of hard to see this graph down here, but I wanted to break out the populations of focus for that 790. So most of our ECM members are in the experiencing homelessness population of focus. This is the unknown population of focus. And then the second largest is the serious mental health or substance use disorder. Okay, so
Ashley,
our provider network.
Can I say
yeah, absolutely.
The kids that you have, do you know how many of those are under 18?
That would be something I can definitely look up. I'm not in my system right now, so I can't get you the numbers right away, but I can definitely follow up with that information.
And I see we have another question in the chat from Sharon. Do we have data on the universe of Marin members who are eligible for ECM to better understand penetration and utilization?
So we do have a list of eligible members in Marin County. We pull the data from claims, from TARS, from hospital utilization, kind of give us a general list of who might be eligible. But because ECM is so not flexible, but we don't have all of the information in our systems. So we have providers who are identifying members that may not be on our list because, you know, we don't have the claims data, or they may be Medicare as their primary insurance. So to answer that question, we do have a list, except there's lots more members out there, so it's not 100% accurate. Okay, are there any more questions? All right. So our provider network, we are still trying to grow in Marin County. So we're looking for providers who have experience with serving the current populations of focus. They do have to be able to bill Medi-Cal. If they are not Medi-Cal enrolled, we do have a contracting and credentialing process that we can help assist you through. And the provider does need to be able to submit treatment authorization requests and bill, of course, but we will, again, help you with all of the requirements there. And if we ever have any interested providers, we have an ECM readiness questionnaire. It's just an easy document where you can tell us about your organization. Definitely not a pass-fail. If we have questions, we would love to meet you and discuss your experience with serving those populations of focus and how you would fit into our ECM provider network. Okay, so I wanted to open the floor for questions. I did put our email address down there, so you can always reach out to the CalAIM email inbox, or you can also reach out to ecm@partnershiphp.org at any time with any questions. I am going to stop sharing my screen so I can see you all, and I am happy to answer any questions you may have.
It looks like in the chat we have a question from Lael. Wow, 250 for children and youth. Can you tell which providers are serving what number of kids?
Yes, so I can tell you, I know Marin Community Clinics is serving quite a bit of those. Let me look at my slides again. Give you the exact number here. Give me 1 second. No, I can't toggle. Sorry, guys. Okay, so yes, like I said, Marin Community Clinics is our biggest children and youth provider. St. Vincent Preventative Family Care, we just expanded his organization to start accepting children and youth, so they have a large number of them. And I think out of the 10 providers who are live in Marin County, those are going to be our biggest players when it comes to children and youth.
I do think most of those are in that 18 to 20 range since it just opened up this month. I can't imagine that somebody put in 200 TARs this month, actually. I mean, that feels like, right? Like, I think because of the framing of the youth being up to 20, up to your 21st birthday, I do think a lot of those are going to be in that we would consider the voting youth age, I guess we could call it.
Yeah.
And not the younger.
Yeah, and we definitely did realize, you know, because at first DHCS wasn't specifying the age definition. So we were, you know, like everybody else, assuming that adults meant 18 and older. So we are kind of assessing our current providers who are serving those numbers that are 18 to 21, just because we want to reflect our data accurately to DHCS. So since they consider those members children and youth, we want to make sure that those providers are indicating that they actually serve children and youth. And then those providers can just add that they're eligible to only serve 18 to 21 age range.
And we can follow up with you, Ashley, to get that exact number for under 18.
Absolutely. Yeah, I'll get that to the group.
Thank you so much. And Lauren, I see you have your hand raised.
Yes, hello everyone. My name is Lauren. I'm a regional executive director at Seneca, and we are one of the providers for Partnership Health Plan for ECM. So I just wanted to mention we had entered in serving homeless under that category, often transitional age youth or young adults, and expanded our population of focus to the children's side just effective this July 1st. So we're expecting those referrals in August, just as some context. But one of the questions, the real question, way I raised my hand, Ashley, is that I'm curious to hear your thoughts on the mechanism for self-referrals of potential eligible members, as opposed to needing a clinic or another provider to execute that referral on behalf of a child or a family to Partnership. Does that question make sense?
And yeah, just clarifying real fast, for self-identifying members, do you mean the ECM providers identifying members or Partnership?
The ECM provider in doing outreach, making a connection with a member who's interested in ECM, is there a clear mechanism for us as an ECM provider to help make that referral on behalf of the member or with the member?
Great question. Yeah. So, and it's actually a great timing too, because DHCS actually in the policy guide that they released this month, they're actually saying that they want to see more identified members from the providers, not coming from the data from the health plans. And so with ECM, there's really no wrong door when it comes to referrals. So you could be out in the field looking underneath a bridge and identify members. You could have members that come into a clinic and you're saying, oh, I think they would qualify for ECM. I think they would benefit from the program. You could also enroll them. We only ask the health plan that you are assessing the members on your end, and then you would just indicate which members you've identified on your monthly reports. Does that make sense? Does that answer your question?
I think it does. I might follow up with you later if that's possible.
Absolutely.
Okay.
And I apologize, Lauren, that you were not on the list. I'm not sure why Seneca wasn't on there, so I'm so sorry about that.
On your slide, Seneca was listed on your slide. Yeah, no apology
Okay,
necessary.
good.
Yeah. I was just sharing that we will be a children's provider here in the next month. Yeah.
Perfect. All right. Any other questions for me? I do have to jump off. I'm so sorry.
Ashley, can you confirm for the serious mental health and the CCS that we're talking about an ACEs score of 4? There had been some questions about that, and I just want to make sure that that is a in stone real thing, that it would be delightful to go lower than that, but that's the policy is 4. Or
it is, yes.
Okay.
DHCS says an ACE score of 4, yes.
Okay. And if they qualify for those services and you get an ACE screening of 4, you don't have to go through the hoops of referring them places. You can just sign them up with that ACE screen qualifies them.
Yes.
Yay.
All right. Thank you, everybody.
Thank you so much, Ashley. I know you have to hop off, but we might follow up with you with some additional questions that we can share out with everybody on this call.
That sounds great. Thank you so much.
Thanks. And I see Alina put in the chat to all ECM and CS providers or potential providers, want to shout out the Aliados meeting, which is a great place to troubleshoot and collaborate. We get together as Marin providers specifically. And I just want to thank Amy for joining this call because you're just such a wealth of knowledge, and thanks for being here. Okay, I know we had a bunch of questions about what is the data exchange framework and what is BluePath doing with Connecting for Better Health, and what is Connecting for Better Health, and how can funding be tapped into? So we asked Robbie Franceschini to do a brief presentation to answer all of those questions. And I'll hand it
Awesome.
over to Robbie. I just want to say, if anybody does have any additional questions for partnership, if you put them in the chat, we'll make sure to follow up with them and get back to you.
Awesome, and thanks, Lauren. And it's great to be back here. For those of you I haven't met, I'm Robbie. I work with Lauren at BluePath, and previously helped manage a lot of the Marin work. So it's fun to be back at the payer funder meeting. I currently manage a lot of our data sharing focused work. I'm our director of policy and spend a lot of time on the data exchange framework. So if there are any questions on any of the content I'm presenting today, please feel free to interrupt me, put it in the chat. If it's, a super weedy question, I'm also happy to follow up with you one-on-one as well. But I'll kind of start with this coalition that BluePath has been helping to manage for the last almost 3 years now, Connecting for Better Health. We are dedicated to the vision that every Californian and their care teams have the information and insights they need to make care seamless, high quality, and affordable. And I always start with this because we actually updated it this year. So this used to be super focused on healthcare, super focused on healthcare providers. And I think one thing is you'll see with some of our content, especially with what the state is doing too, we're increasingly focused on social and human services, CBOs, social services information. And I think especially in the context of CalAIM, figuring this out across sectors will be critical to not just solving our health information exchange needs, but also community information exchange, care planning, things of that nature too. In terms of what this coalition does, we've been focused on a couple key priorities this year. I'll go over what the data sharing agreement is at a high level in a moment, but we've been focused on education work and helping the state get folks to sign it. We've been advocating for more funding. So this includes Medicaid funding. We've also been advocating for CalHHS to get creative. How can we think about how we can leverage and bring together education funding, climate funding, and the like? Also, again, thinking about how do we integrate social services data into this work, really focused on how we can bring all providers into the framework and integrate data more seamlessly. And then also too, helping provide input and feedback on the data sharing agreement policies and procedures. We also track a lot of legislation as well and provide input to folks on anything from, reproductive health laws and privacy to technical things like how do we actually segment data and make this stuff happen. In terms of who's involved in this group, this is just a little smattering of some folks who are involved. We've got health plans, providers, labor, consumer groups, some tech companies as well as HIEs involved. And relatedly, one of the key things we're working on this year is the Multi-Association Data Exchange Framework Education Initiative, which is a huge mouthful. We are one of several grantees from the Center for Data Insights and Innovation within California Health and Human Services to help educate different association trade group members about the data sharing agreement, what's in it, put together educational materials, webinars, and the like. You can see here in the middle, we're working with 6 different trade groups. So we're working with APG medical groups, family docs, PBGH's quality collaborative, as well as area agencies on aging. The An Insured Project is one of our partners in this initiative, helping us put together educational materials, and we'll also be highlighting the data exchange framework at a couple of their roundtables. I think some of you might be part of their Bay Area one. And we are helping support this work with Transform Health, which is another consulting firm that does a lot of work in the medical health space. So in terms of what we're doing with that work, like I said, we're doing a lot of tabling. We built on an information hub. I'll put some links in the chat for folks. We're creating tailored materials. We've got a speakers bureau and story bank as well. And we'll just put out there too, if folks have questions, if you need educational materials, happy to follow up after this presentation. Part of our grant is to, plug into groups' forums and help educate folks. So happy to follow up on how our team is able to help with that. So to kind of give a little context to the data exchange framework, this is what the Center for Data Insights and Innovation put together. They are the agency within Cal HHS that is overseeing the rollout of the data exchange framework, as well as health IT policy in the state. Really, what the DXF is a framework that has a couple pieces that I'll go over, including a data sharing agreement that really looks to create new connections, efficiencies amongst health and social services providers, and also to ensure the secure and appropriate exchange of information. So to make sure that information is getting shared, but it's getting shared in a way that's compliant with the law and policy as well. And in terms of kind of how to situate this is one way we've been thinking about how we can kind of best describe how the data exchange framework supports other initiatives. I think CalAIM, and I know CalAIM's a lot, but in particular ECM and community supports, behavioral health increasingly too, thinking about how we can take not only our delivery systems and payment systems out of silos, but also data that can support behavioral health integration, data sharing with community-based organizations who may be participating in, say, ECM, and wondering if a patient's been discharged, right? And that requires information from a hospital in a timely manner to know if that's happened. So CalAIM is one of the, I think, areas that DHCS in particular has identified as an area where they see this framework supporting work. Quality and equity reporting, being able to get the demographic as well as clinical data we need to make sure we're measuring quality, especially as DMHC has undertaken its equity initiative as well, and will be holding health plans to certain equity metrics and not just to kind of clinical quality metrics. The healthcare payments database, this is an undertaking that the states had for a number of years to be able to aggregate and analyze claims data from health plans in the state. And then additionally, the Office of Healthcare Affordability, which is an initiative that was formally launched this year, really to help create benchmarks and help stabilize the cost of healthcare in the state, really looking at pricing across providers and plans in the state, and figuring out a framework to be able to, prevent the ever increasing cost of care. So in terms of how this work came to fruition, a couple years ago, folks were debating whether we should create a single health information exchange in the state. So that generally in most states is a single entity, often a nonprofit, that connects to hospitals, to medical groups, FQHCs, health plans to help collect as well as share information and create what we call longitudinal patient records. California's tried this a couple of times before for a whole host of political, I think, market, historical reason. It just hasn't happened at the state level. And what the compromise was to create this data exchange framework, really to create the rules of the road for data sharing in the state. So as I said, it's the rules of the road, it's technology agnostic. It additionally is looking to create a strategy for unique, secure digital identities, as the law says, which in, I think, layman's terms, it's really figuring out a way to better do person matching. So to find the right, match the right Robbie Franceschini and not say to one of my relatives with the same name as me. So the state's also working on that as well. And when it isn't, is like a single repository of data or technology system. It includes, as I mentioned, both a data sharing agreement as well as these policies and procedures, which are really where a lot of the focus is on this work right now. And these are on everything from privacy and security to technical requirements, what are permitted uses for sharing information and the like, and really lean on federal law and state law in putting those together. So where are we in this process? So this is the latest timeline that the state has laid out. I think the key milestone that I would raise to this group is that right now, the state is working to finalize their program for what they're calling Qualified Health Information Organizations, QHIOs. These will be intermediaries that signatories to the agreement can join to help share information on their behalf. So like I said, rather than one single statewide health information exchange, as they're called out there, the state is creating this system, which will be sort of a network of organizations that can share information on your behalf if you so choose to join one. And those will be rolled out this fall. And organizations will have the choice to join one or not. It's not mandatory, or they can, choose to connect directly with their data sharing partners, respond through a third-party vendor if they'd like to request for information and the like. And another key milestone that we reached this year is that under the law, several types of organizations were required to sign the data sharing agreement. This includes general acute care hospitals, physician orgs and medical groups, SNFs, health plans, clinical labs, and acute psych hospitals. To give you a sense of who in Marin has signed, we've seen the list tick up. So far, Partnership Health Plan has signed, Marin Community Clinics have signed, Novato Sutter has signed, Kaiser Permanente just signed 2 weeks ago, and Meritage has signed. And I may be missing a couple orgs in the county that have also signed as well. Right now, there's no penalty being enforced yet for not signing, but we have seen those numbers kind of tick up as the year has progressed. And I think as word has gotten out about the fact that the data sharing agreement exists and that folks had to sign it, there was some ambiguity with some of these terms and who falls under them, that are being resolved with the state. But these are the organizations that are required under law to sign the data agreement at this time. Although other organizations are encouraged to sign on as well. Increasingly, a lot of county agencies have, especially behavioral health, community-based organizations too. So I'll just note those as well. Just to highlight what does this data exchange framework and the DSA focus on? It focuses on both health and social services information, which is a new definition that we're using in this world now. It includes not just protected health information if you're familiar with HIPAA, but also personally identifiable information, and a whole host of other information to metadata, digital identities, and other data that signatories may have in their possession. And in terms of what we've been doing with this work, we've got a whole host of policies and procedures that have been put out there by the state and finalized. Right now, we're working on others, including helping to finesse things like the technical requirements, what kind of data needs to be shared, how does it need to be shared, how soon does it need to be shared, in particular, as we kind of reach next year where organizations will have to start sharing information under the agreement. I will say, I think one gap, which our coalition's been pointing out a lot, is that we haven't been as focused on the social services piece. A lot of organizations are developing community information exchanges. I know Marin, there are meetings underway on that, really to help with, sharing social care information, care plans and referrals and things like that. There's also, other efforts with health plans and their networks within CalAIM to be able to share information. And I think that's really the next step in this work, is defining what do we mean when we say social services information. We don't have a law like HIPAA that we can point to, a single law to say this is the data set, these are the purposes for which it can be shared. So I think that is going to be some of the legwork that stakeholders will have to undertake with the state, especially over the next year, to really make sure that this framework truly can support CalAIM. I'll go ahead and get to the fun stuff, the funding that's available from the state to fund this work. So right now, if you're an organization and you sign the data sharing agreement, you can become eligible for one of two types of grants. There's $47 million available, so pretty significant. And the two types of grants organizations can apply for are one, to join that QHIO I mentioned earlier. Those have not yet been named, so organizations can get in the queue, if you will, and can secure their spot, negotiate their funding amount, which I'll get to in a moment, with the state, and choose their QHIO this fall. The other option is technical assistance, where organizations can build your own adventure, if you will. You can procure a vendor or a consultant to help you with a strategy, to obtain, say, a vendor's product to help you with data sharing, upgrade your EHR, onboard to a care management platform. It's pretty open. And these grants are only open to folks who have signed the data sharing agreement, just to clarify. In terms of where we're at with this work, anyone who signed can apply. Previously only mandated signatories could. Right now, if you're another type of organization, say a county or a community-based organization, you can also apply in this round 2 phase through September 1st. And you know, what are the funding types that are available? It's pretty open. I think the one sort of restriction that the state has put in place is that depending on whether you drew down previous funding, so say you're a healthcare provider who funds for meaningful use for your EHR, if you don't know what that is, that's totally okay. But say you use that funding, that'll be incorporated into figuring out your rate, as well as whether you participated in past onboarding programs for health information exchanges in the state. And here on the right side, we've got what the funding maximums are. I will say that these are a bit squishy because there is the additional consideration as to whether you serve an underserved community. So you can see if you do, and that is largely based on your Medi-Cal patient mix, you can get up to twice the amount of funding. So for a hospital, that would be 100K. If you're not eligible for that bump, it would just be 50. And who can submit a grant? Organizations can band together as groups to apply. The applicant is just the organization who applies. And I think increasingly trade associations, county medical associations are trying to figure out how to bundle together in grant applications. And I'll just jump forward past these funding request scenarios to also highlight too, what are some other funding opportunities that can help support your data sharing work? I'll point out the technical assistance marketplace through CalAIM. If you're an ECM or CS provider, you can draw down those funds. CalAIM PATH funds and incentive payment program funds, if your managed care plan is offering those, are 2 other funds where you can use those funds to help build out your data sharing capacity or strategy. There's also the Behavioral Health Quality Incentive Program, which is available to county mental health plans. And there will be equity and practice transformation grants, which will be launched by DHCS later this year. And one of the allowable places for funding is for EHR and other HIT upgrades. And I'm happy to provide more information on these, and I'll put a fact sheet in the chat too that we created for folks to kind of be able to sift through these different funding opportunities as well. How do you sign the GSA? There's a portal online. I'll also steer for folks, if you're interested, we have a short video on how to sign it, where we had folks from the state join us to walk folks through. It's pretty easy. And there also is the latest signatory list on the state's website as well. And I will just also highlight too an upcoming event we're hosting with Aliados. Amy's here, who's been on our planning team for that. Super exciting. So Aliados has funding from HRSA to host an event on health information exchange and community information exchange. And we're super excited to be collaborating on this. We'll be teasing out what is HIE, what is CIE, how can these organizations band together and partner together and collaborate to help serve their communities. We'll have speakers from both within and outside of California to talk about their experiences developing these types of exchanges and organizations and how they've been able to partner with others in the community. It'll be on August 16th. So hope to see folks there. And I'll also put that link in the chat in a moment. And a couple other resources that are in here too. We've got an email address if folks have questions about the data exchange framework. We're happy to answer them or help get them answered. We've got an info hub that we built out as part of our education grant. And there's a couple other fact sheets and resources from the state as well. So I think with that, I know that was a lot and a lot of acronyms, and I'd love to see if there's any questions I can help answer from anyone here.
Does anybody
All right,
have any questions for Robbie?
Well, if any come up too after the meeting, happy to answer them too.
Okay, well, thank you so much, Robbie, for your presentation. I'm going to hand it over to Gabby, who's going to talk about Find Your Way updates and the resource guide. We have an exciting provider event coming up that we'd love everybody on this call to join, and we'll talk a little bit more about that, and also our scholarship program, which we're really encouraging all young people ages 12 to 25 to apply for. And I'll hand it over to Gabby. Do you have the slides, or would you like me to share the slides?
I have the slides PDF version, if that's okay with me sharing that.
Sure, sounds good.
Awesome. Hello, everybody. My name is Gabby. A quick introduction about myself is that I work with Lauren at Blue Path Health, and I help support her around Marin 9 to 25 and Find Your Way. I graduated from Dominican University of California with my bachelor's in global public health and a minor in leadership, and in 2021. And as soon as I graduated, I enrolled in the Master's of Public Health program at University of Nevada, Reno. And I found an internship here with Lauren, and I'm so thankful for it. And I can't wait to talk to you guys about the updates on what we have been going on with our youth. As Lauren mentioned, we have our resource guide and our scholarship. So first things first is our resource guide development. It has been a long time coming. A lot of youth have put a lot of hard work into this, a lot of thoughtfulness, I will say, started back last summer. And I hopped in during the fall and winter and have been working with them to even create their logo with the Ledyards, which is a graphic design studio that we worked with. And they also helped teach the youth how to use Adobe Illustrator and how to pick the color scheme and everything. And so that's how Find Your Way came to be. Scroll back up to just take a look at the logo here. This is what the youth worked on in terms of, this is what they felt really represented the youth wellness campaign. And yeah, no better words than to help others find their way. And that's why there's an arrow and everything. And that is all completely youth developed. And so from there, that's where we decided our categories for our resource guide, and then started gathering the resources, and I helped vet them. And that's what led to our launch this summer, which is available online and in print. You can visit our website at on Marin 925's website on the Find Your Way page. The printed resource guide has yet to be released, and we hope to have that out in all schools in Marin and different organizations. And so again, yes, right here is the link to our resource guide. And so what we have upcoming is a provider meeting on August 17th at 12 p.m. And you can register on that Zoom link. The reason for the meeting is to invite all of the providers that are not only a part of our resource guide, but any type of provider that is interested in learning more and possibly being a part of the resource guide. We have many different categories such as mental health, substance use, academic and career, immigration help, and everything. So if you are interested in joining, or at least wanting to learn more and whether your organization fits the criteria for a resource guide, we would love for you to make it. And again, it will be over Zoom at 12 p.m.
And just to add to that, Gabby, I think Gabby did an incredible amount of work calling each and every organization on the resource guide, because I think it was really, really important to our young people that every resource in that guide, if they make a phone call, they could talk to somebody who can either offer services or connect them to somebody who can offer services. And that was really, really, really important. So that meeting will be explaining why we selected the resources that are on the guide. For example, Seneca does incredible work, but they require referral as far as we know. So we didn't include them in the guide. But if Seneca comes to the meeting and says, actually, I have some services that apply, they can fill out a form and be added to the guide. So it's an iterative process. And we're hoping to add more resources. If you want to break down your agency by program, we really, really encourage agencies to do that. So if one program fits in one category, they can have that specific program pop up. And that way, if a young person reaches out, they get directly to that service. So that's what that meeting will be about. And that's what that form is where you see submit edits.
Yeah, thank you, Lauren. And to add on that, our resources, we decided to extend it not only here in Marin, but to Sonoma and Petaluma area. So it also applies to organizations out there. And so for our scholarship that we just launched, it is for youth ages 12 to 25 for a $500 scholarship to join our cohort from October 2023 to July 2024. Applications are due September 19th. And what we require of youth is that what it's really meant for is youth that are already a part of some type of community initiative, activity, or internship, because we feel that while they're a part of that most of the time they're not being compensated. And so we wanted to provide that and to address that need. And based on feedback from our previous youth visioning work group, which maybe some of you have heard of, Find Your Way is what we officially call it now, and has sort of absorbed our youth visioning work group. And so we invite the youth that if they're selected to join our scholarship program, that they join our virtual quarterly steering committee meetings, completing quarterly surveys, attending our wellness festival, which is in person in May, and participating in 2 check-ins with a Marin 9-25 staff member. Now, if a youth is still interested in our scholarship program, but is not yet a part of some type of community initiative or internship, then they are more than welcome to apply for our Find Your Way visioning group. Now, this one does require in-person participation, and they meet 2 times a month. They have to submit the scholarship application first before they apply for this one. So I want to emphasize that. And the point of our visioning group is that it's a lot more hands-on compared to our scholarship group, where it's just about attending our meetings, quarterly surveys, and no in-person commitment besides our wellness festival in May. With our visioning group, this is sort of like our advisory team, our strategic team, in terms of helping us produce these projects like our resource guide or even our provider meeting, and making sure that they're all youth driven by helping us create our agendas, overseeing the Find Your Way scholarship group, and overall helping the promotion of all of our projects and overall visibility here within Marin. They also have an option of joining our OD-free youth action team as well, if they are not interested in the youth visioning group. I'm sorry, in the Find Your Way visioning group. And this one is dedicated towards substance abuse, reducing harm against prescription drug abuse, and saving lives, working with OD-free Marin. And so specifically, our youth action team is dedicated to empowering youth to overcome this opioid crisis. And that's through virtual monthly team meetings, conducting naloxone trainings, and promoting our crisis text line for youth in Marin, as well as providing input on how to support young people at risk, whether that's, allowing us to table at their schools or any other organizations that they know of, or events. and helping gather and distribute educational materials about opioid use and addiction. So again, for our scholarship application, those are for youth that are part of a community initiative. And if they're not, then they're more than welcome to join our Find Your Way Visioning Group or OD Free Youth Action Team. And that's not to say that they're gonna receive any additional stipends, but I want to emphasize that for all of our quarterly steering committee meetings, all youth ages 9 to 25 that attend can receive a $25 gift card. And so moving on to the NOD app. So this was something that was worked on by our youth visioning work group that participated as a focus group for this app. And this is a youth wellness app that was created and wanted feedback from youth before they launched it. And so it's rooted in evidence-based practices in terms of helping these youth help build not just confidence, but social skills, having mindfulness. And the goal is that sort of like to replace their use of social media in the morning or at any other time, and to address the mental health needs that increased during the pandemic. And so our youth visioning work group provided a positive feedback demo version and recommendations for the county rollout. And so we're excited to announce that all Marin High School students and first-year graduates will have access to the NOD app, which is rolled out this summer. And feel free in the slides that were shared with you to see the elevator pitch video by our youth co-chair, Sammy Lee. And I want to emphasize that this app is free and that any youth that sign up, they don't have to necessarily use their school email. They can use any Gmail, but they can just make note when they sign up on the app where they go to school. But any email can be used to sign up. And so next steps is that as we review and provide feedback for the resource guide, especially during our provider meeting, that's really what we're going to be looking forward to. And having this provider meeting, that's not going to be the one and all. We want to continue checking in with our providers because, as you know, having a resource guide, it's important to have it updated and changed in any way just to make sure it will always be accessible to these youth. And then we have our next steering committee meeting on September 12th at 4:30 p.m. And the theme is September Suicide Prevention and Recovery Month. Our keynote speaker will be Lynn Murphy from the San Rafael Police Department, and she will be talking about wellness. She's also a co-chair on the Suicide Prevention Collaborative, and we also have lightning rounds with some youth that pertain to this topic. So we look forward to you all being there. And so if you have any upcoming events or opportunities, please feel free to send them my way. I'd be more than happy to add them on our website or on our social media. And so don't hesitate to let me know. I know that was a quick one through, but I want to be respectful of everyone's time. So with that said, are there any questions?
Thank you, Gabby. Also, to add to the steering committee meeting, we actually met recently with the Office of Equity, and they're going to do a brief presentation on the participatory budgeting process at the steering committee meeting. All right, are there any questions about Find Your Way? Yes, Sharon.
Hi, everybody. I know it's just a few minutes till 5, so I won't put this out as a question to answer, but it may be something to talk about in the future. You know, I'm just aware of, like, as we think about this group as a payer funder group, and we had the, you know, a presentation for partnership around CalAIM. I'm curious, you know, and then this body of work is very youth driven in terms of, you know, what is the kind of resource guide that meets the needs of young people. And we also know that there are payers that use their own resource guides that may or may not necessarily be, you know, sort of aligned with some of the principles or vetted in the same way that, you know, you all are describing. And so I'm curious, and again, not for 2 minutes till 5 o'clock, but just, you know, whether or not it's worth having a conversation in the context of the payer and funder conversation around how do we, are there opportunities to create more alignment between the payer and funder resource guides, the process that those guides are used to be developed or to be disseminated, and how those can or either be better aligned with, a resource like Find Your Way or work complementary, or at least not work in conflict. So
yeah, I think that's definitely something, that conversation definitely should be had, and we can put that on the agenda. And I think we're also going to have more strategic conversations. I know Timmy and Sam were unable to join today. They each had family emergencies that they had to deal with, actually. So we are talking about setting up one of our future, upcoming payer and funder work groups to talk about strategic planning for the payer and funder work group and what are our goals and objectives over the next year or so, especially in light of the CACHI grant. And I think that's definitely something that should be on the agenda. I also want to highlight that Find Your Way will be presenting at the Community Information Exchange meeting, which I don't think there's a link for yet, but once there is, I can send out to that group. And I think there will be a conversation in that forum as to how does 211 and Unite Us and all of these different resource directories, how do they complement each other or inform each other, and how are we collaborating and working together? So definitely an important topic. Okay, well, thank you everybody for joining. I'll stick on for another few minutes in case anybody wants to touch base or have any questions. I'll stop the recording. But thank you so much